All right, everybody. I see a bunch of participants come in, which is great. We're really excited to have you. I have an excellent panel today. I'm Josh Page from Triers Children's in Philadelphia. I want to welcome you guys to You Are Not Alone patient education webinar from the Setting Scoliosis Straight Foundation as a part of National Scoliosis Awareness Month. We're very excited for this. So what is this? We just want to help raise awareness. We're hosting this great and powerful informative webinar that brings together patients from across the world, literally, to share their personal scoliosis journeys, highlighting the challenges, triumphs, and insights they've gained along the way. In addition, we have some renowned specialists going to present to us some evidence-based updates on the latest scoliosis treatments, and we're going to explore the important connection between mental health and the scoliosis experience with Dr. Deane. So our event moderators, that's me, Dr. Josh Page from Triers in Philly. And we also have Jen Bauer from Seattle Children's Hospital. They'll be talking to you guys shortly. Our guest speakers, we have a fantastic group today. We have Ms. Diya Baldawa and her mom, Jyoti Baldawa, will be talking to us about spinal fusion. Jenny Liu, one of our adult scoliosis patients. Kelly Nguyen, a bracing patient. Simrena Atwal is one of our VBT patients. And finally, Dr. Kyle Deane, our pediatric psychologist, will be speaking to us today. So some of the instructions, we'd like you guys, participants, if you have questions, please submit them through the Zoom Q&A section. We're gonna do our best to answer all of them, either live or if not, directly in the chat section there. And so we'll pose those questions there to the presenters. We're gonna start with understanding scoliosis with Dr. Bauer, then talk about bracing with Kelly, spinal fusions with Diya, through the parent's eyes with Jyoti, VBT story with Simrena, and then You Are Not Alone with Jenny Liu, and finally rounding out mental health and self-image with Dr. Deane. So what is Setting Scoliosis Straight? We're a 501c3 company or group that was established in 2018. Our mission is to better discoveries and advanced techniques in the treatment of scoliosis in children and adolescents worldwide. We really envision a future where children with scoliosis can have the ability to live happy, healthy, and productive lives. All right, so it's my pleasure to introduce the great Jen Bauer from Seattle Children's Hospital. She's going to talk to us about understanding scoliosis. Take it away, Dr. Bauer.
Awesome. Thank you so much. So if you're new to scoliosis, it might sound crazy to you, but we've got some simple ways to explain it. And so our goal here today for me talking to you in a couple of minutes is just to cover what might be your biggest question. So what is scoliosis? How did you get it? And now what do we do about it? So what is it? It's really just a curve of the spine. If you look right straight at the spine, it means you have a little bit of a curve. At least 10 degrees of a curve makes us say, okay, this is scoliosis. And it can be different shapes. It can be a C shape, it can be an S shape, it can be a couple S's. It depends on the type of scoliosis that you have. Probably someone found the scoliosis in you or investigated the scoliosis by having you kind of bend down and touch your toes and use this little measurement on your back. And the reason that we use that is because the curve causes a couple changes in your body that we can see just from looking at you. One of them is that the rib cage twists with the curve. As you can see here, as this person bends forward, what you're seeing is the rib cage twisting around. Another thing we can sometimes see is that your shoulders are out of balance because of the curve, where you're kind of tilted down on one side or the other. And another thing that might be obvious when you look at someone is that the body shifts to the side a little bit. And this is all just because of the way that the curve is shaped. The important thing to know about curves is that they tend to get bigger as someone grows. And so if you look at this curve in a 13-year-old girl, she was just starting to grow very quickly. And in just 6 months' time, this curve got to be a lot bigger. And so that's why we do a lot of things for these curves, like watch them and perhaps brace them, which we'll talk about more in a second. So that's what scoliosis is. It's a curve of the spine. But how did you get it? Well, there's a lot of different types of scoliosis. These are pictures of different types and different curves, and you can see they're all different sorts of shapes of curves. And that's because there's all these different types of scoliosis. But the most common type is idiopathic scoliosis. And if we talk about idiopathic scoliosis, we think that comes from some combination of genes that maybe has some effect with the way that your nerve works and definitely has to do with the way that you grow and maybe has something to do with the things that you put inside of your body and the way that your body makes different hormones and chemicals, and maybe the way that the building blocks and cells of your body and collagen works. But you can see when we have a lot of different thoughts about it, probably what we know is we don't actually know yet. And that's the truth right now. We don't know exactly what causes idiopathic scoliosis, but it's probably a combination of these things. And it can get passed down to some degree, not just like blue eyes and brown eyes, but to some other degree of genes. So if you have this scoliosis, you're not alone. That's an important message that we want to tell you. About 14% of all people have a curve of at least 5 degrees. And if we talk about the diagnosis of scoliosis, which is a curve of at least 10 degrees, 2 to 3% of the population has this. So in your school, if you have 100 kids and you have scoliosis, there's probably 2 other kids there who also have scoliosis. And these are some people that you might recognize out in the world who are doing amazing things that have scoliosis too. So when we think about what do we do for scoliosis, I think the most important thing I want you guys to know is you should just be living your life to the fullest, just like all of these people have. And we're going to try to figure out some ways to help you do that. One of those ways is to try to keep the curve from getting bigger as you grow. And we can use some braces to do that and some physical therapy. And we're going to hear more about that from a patient's perspective soon. Sometimes when the curve gets a lot bigger, we have to do a fusion, or we offer a fusion where we use some screws and rods to move the spine straight and hold it straight. We can either do a short fusion or sometimes we have to do a longer fusion. And then we can also do something called tether, where if you have a lot of growth left, we can, instead of coming in the back and fusing the spine, we can come in the side and make the curve tight to hold it straight. And sometimes we can combine the two of a fusion and a tether. And so all these things we're going to hear about more soon from some patients who have had these treatments. So up next, I want to introduce you all to Kelly Nguyen. She's going to be talking to us about her bracing story. Kelly, take it away.
Thank you so much for the introduction. Hi, everybody. My name is Kelly, and I'm super excited to share my story with you, one that shaped much of my childhood. This is my scoliosis journey, and I hope it resonates with some of you in the audience. So I was diagnosed with scoliosis when I was 8 during a physical exam with my pediatrician. I still remember how many times he told me to bend over, and he was palpating my spine so many times. I could tell something was off, and he found a curvature. I was sent off to get x-rays, and they found an S-curve. It was 25 degrees in the thoracic spine, 44 in the lumbar spine, and I believe my spine's also a bit rotated left and a bit of kyphosis as well. But I was referred to an orthopedic spine specialist soon after, and we decided to get fitted for a brace as my main treatment option. So the brace that I ended up getting was a custom molded hard plastic brace, most closest to a Charleston or a TLSO. And I wore it for up to 23 hours a day. I only took it off to shower, to exercise, or to swim. As for wearing it day to day, it was pretty tight, restrictive, and physically uncomfortable. I noticed bruises and changes in my body structure a lot. And I have a lot of memories of my mother taking me out of middle school in class to go get adjusted at the orthotist office because as I grew older, the brace wouldn't fit. So we'd had to get modifications throughout my 10 years of wearing it. And honestly, the hardest part about the brace wasn't just the physical challenges with it. It really clashed with something that I enjoyed, performing. I grew up singing and dancing in show choir. It's kind of like Glee. You sing with synchronized dancing. And so being on stage was my passion. It was how I expressed myself. It made me feel very free and liberated. But having to wear a back brace felt a bit restrictive, kind of like losing that creative freedom at times. During rehearsals, it was hard to breathe properly when I was singing, and I definitely did not move the way I used to pre-bracing. And over time, I noticed I was losing a lot of my flexibility, and I had to work twice as hard to keep up with the other girls in the dance company. What got me through it though wasn't just my amazing medical team, my doctor, my orthotist who oversaw my bracing treatment. It was definitely the people around me. The girls' performing group never made me feel different. If anything, they were the first ones to remind me that I was still graceful, still talented despite bracing. And that support honestly meant the world to me. It helped me find my voice again. It gave me confidence, especially in moments where I doubted myself during auditions and performances. I ended up stopped growing around 15, and that's when most doctors get their patients off the brace, but I was held in it a bit longer, up to when I was 18 because of the severity of my lumbar curvature. I was still monitored with x-rays due to the high-risk curve, and I was considered a possible spinal fusion candidate throughout my adulthood, which I still get monitored for it to this day. That was towards the end of high school, and that's when I started Shaw therapy to try to hopefully avoid surgery and also regain part of the flexibility that I'd lost throughout my childhood. After bracing ended at the end of high school, I started a new chapter in my life. I went to UCLA for undergrad, where I just graduated last week. I found a great support system, other people with scoliosis, people with chronic conditions as well. And I resumed scoliosis care at UCLA Spine Center and attended physical therapy with UCLA Health for back pain. And thanks to the amazing care that I've had there, my curve has remained stable ever since. Reflecting on my childhood with scoliosis, it definitely taught me how to keep showing up during difficult moments. And over time, those moments shaped my resilience, but more importantly, they helped me foster my empathy. Growing up, I personally didn't know anyone with scoliosis when I was a child. I still remember getting like weird stares or questions in the girls' locker room whenever I would take my brace on and off for dance rehearsal. And so trust me, I know what it's like to go through this journey alone or misunderstood. And even with the possibility of spinal fusion looming in my future, I find a lot of strength and solace knowing that there's a community backing me up. Which is why I volunteer now with Setting Scoliosis Straight to help others feel seen, supported, and reminded that their story also matters. And so, if there's anything I want you to take away from my story, if you're watching this and going through scoliosis yourself, I just want to say from an older sister-like figure, so to say. You're not alone. There's a huge community behind you who is there to understand you and is here to walk this path with you. This has been my scoliosis journey, and I hope it resonates with many of you watching. Thank you for listening.
Kelly, wow, what a great way to lead us off. That is incredible. What an amazing journey. Like, dude, you blew it away. So first of all, oh my gosh, congratulations on graduating from UCLA. That is bananas.
Thank you.
You're
Thank you
through the
so
moon. That's
much.
fantastic. You're gonna take a little bit of time off, or are you getting like into your next journey next week?
Trying to find a job right now, so still in limbo for a bit.
You've earned a break. That's okay. Don't worry about it. Again, congratulations. That is
Thank you
so
so
cool.
much.
All right, just looking, we're going to ask a couple questions of you now, just waiting on it. If you have all the attendees, anybody, please feel free to ask any questions you have. We'll get to them as many as we can. We'll start out with some of the bracing questions. So I got a question for you. You said you wore it to school, which I think is oftentimes what I hear from my patients. And when I wore my brace was the most fun I had was trying to wear it to school. How did you get through that? Because I know, at least from what I hear from my patients, that can be the hardest time to have to wear it because you're worried maybe about other kids seeing it or self-conscious. How was your first couple of days wearing it to school? How'd you get through it?
First couple of days is honestly mostly about like the comfort of the brace. I was still getting used to how just bulky it was, and I had to get a new wardrobe to try to hide the brace under the clothes. And I think I felt most vulnerable in like the girls' locker room when you changed in front of other girls. And it was something that I tried to hide for a lot of grade school. And it was really uncomfortable when the weather got hot. I mean, it really chafes, it causes bruising. So it was definitely a rough couple years for sure.
Sure. So you found a lot. I mean, again, you wore this for a long, long time. You did a great, great job. Sounds like you had a really great support staff. Did you find anything online, any other resources outside of like your community that you live in that you could maybe give some advice to for the attendees?
I tried shot therapy. I think that was the only thing that I tried other than whatever my doctor told me. I just really, um, followed the bracing treatment religiously. That was like the best thing that I stuck to. But exercise is really important. I feel like making sure the core muscles are strong, like that will go with you for a long time. Just making sure
Wow.
your core is braced.
That's good for all of us. That keeps the back doctor away. Last question from the chat. Did scoliosis affect you in college at all?
For some reason, growing up, I did not have back pain, maybe because I was just younger and I was still growing. But I noticed in college, I started having back pain, especially the lumbar spine, where it was bunched near the curvature. That's when I started physical therapy again. But thankfully, the curve's been stable, but that's just something that I watch out for. And I definitely avoid certain movements in the gym because of the pain.
Sure,
So
sure. All right. Well, Kelly, thank you very much. You're a true warrior. That is awesome. It's so great to hear your story. There's
thank
still a
you
couple
so
more
much.
questions we won't be able to get. Just want to keep on time here. So Kelly may be able to answer a couple of your questions in the Q&A. We're going to jump to our next presenter, Diya Baldawa, who's going to tell us her spinal fusion story. Diya, take it away.
Hi everyone. So I'm super excited to be here. My name is Diya Baldawa and I am 16 years old. So I have been living with scoliosis for most of my life. And today I'll be taking you through kind of just like the major parts of my journey and starting with like my diagnosis. I did do back bracing for a little bit and then I had my spinal fusion and also how just volunteering with this amazing community has helped me grow and kind of heal. So my curve was first found at about 24 degrees when I was 4 years old. So it was monitored regularly every 6 months, and that went on for a while. And then when I was about 12, COVID-19 hit and we stopped going so regularly. So we missed an appointment. And that same year, I had like my growth spurt. So my curve progressed to 43 degrees. And we were told to start bracing right away. Um, to kind of avoid bracing because we heard about like how painful and everything it was, we tried a chiropractor in the beginning. I live in San Diego, so from San Diego before school started, we'd drive up to LA, get adjustments, and come back. But that didn't show results, so I did start bracing. Bracing was definitely difficult, like Kelly talked about. I definitely had some of the same struggles. I wore it 20 hours a day, and it really affected like my school, how I saw myself. Um, at first, bracing did reduce my curve, but eventually it stopped working and we had to consider surgery. Uh, so I had my spinal fusion surgery when I was 13 years old. It was during winter break in 8th grade. And leading up to it, I was honestly pretty scared. Surgery felt like such a big step because for most of my life, scoliosis was just a small part of it. It was just something to monitor, but now here I am getting surgery. So it was necessary, I knew that, but the whole thing was overwhelming. I remember the day of the surgery was definitely emotional for like my whole family. I remember saying like bye when they wheeled me in and just trying to stay strong overall. Um, I was nervous, but the surgery lasted a couple of hours and I spent a few days in the hospital recovering. Um, it was kind of scary at first because I had like IVs and drains and monitors and everything. And I couldn't move too much at first, but they did make me get out of my bed and start walking like the day after I got my surgery. So those felt like huge accomplishments. Um, the first few weeks at home were also pretty difficult. I couldn't bend or twist, and I remember I was on my bed most of the day. Uh, Things like getting out of bed, showering, I needed some help for that. And then about 3 weeks later, I went back to school, but mainly for half days because in the beginning I was still in pain. Uh, I had to give up a few things I loved, like swimming and PE, which was definitely hard because I thought that was my whole life in middle school. And then slowly things did definitely start to get better. Each week you would see drastic differences. I was able to do a lot more. And in the beginning, I was definitely self-conscious of my scar, but and I didn't want people to see it, but over time, I think that changed, and now it's a part of who I am, and I don't mind. Um, Spinal fusion definitely changed my life, but I think in like a good way. Uh, so again, the recovery did take time physically and mentally, but and you have to be really patient with yourself. I am now almost 2 years post-op, and I definitely feel strong again. I can do all the things I love. I don't feel like I have any limitations. And I'm really grateful for my parents and the doctors, and my friends. Everyone I had to support me was absolutely amazing. And obviously the Setting Scoliosis Straight community. I started volunteering a lot more this year, but I started last year. And I think one of the best parts of this community is just meeting so many amazing people who have ideas about scoliosis or have been through something so similar to what I've been through. And I also love hearing about the research being done. It makes me think there are a lot of like steps being taken in the right direction. And I think sharing my story and just hearing others has also been really healing. So I'm very glad that I get to volunteer here and I feel so lucky. And it's definitely something you should consider if you're comfortable sharing your story or just open to talking about it. But yeah, I hope you guys got something out of this.
You did, Diya. Great job. Wonderful talk. Let's jump right out to Mom, Jyoti Baldawa, who's joining us from India, where it's, I think, 5:30 in the morning. So thank you so much for making time for us, and love to hear your side from a parent's perspective on a scoliosis mom. Jyoti.
Hi, everyone. I'm so excited to be here. And my name is Jyoti Baldawa, and I'm Diya Baldawa's mom. And I am here to share my story, who watch my kid as a parent. She grew up with scoliosis. So when your child is diagnosed with scoliosis, with something you've never heard of, it feels like your world shifts. Like I've never heard of scoliosis before. None of my family members has also heard of it. So as an Indian mother, I looked around a family gathering and felt like no one could understand what we were going through. And it was incredibly lonely. And it was very, it was very frightening to us. So every 6 months, I will bring a notebook full of questions to all Diya's appointments. I wanted to feel prepared, but deep down in my heart, I was like terrified. I would pray all the way there and cry on the way back, sometimes with relief and sometimes with heartbreak. Scoliosis was like always on my mind. And then when we, as Diya mentioned, like when we missed that one appointment during COVID, I blamed myself. Like every night I used to cry, her curve had progressed and I felt like I had failed her. We tried everything, long drives to a chiropractor. I'm sorry. I just remember those days. And early morning, like nothing worked. So when she started bracing, I saw her push through her daily discomfort. Her strength really amazed me. Like she was the one powerful among all of us during that time. So I hugged the surgeon and pretended to be strong, but inside I was like completely broken. I cried the whole time she was in surgery and prayed every prayer I knew. As she recovered, I had to stay strong, not just for her, but for my whole family. I learned to be her anchor, but I failed many times. And now 2 years later, she's thriving. She moves freely and lives her life fully. Watching her embrace her scar, I feel so proud. I especially feel so really proud of my baby. She's working with Setting Scoliosis Straight and helping others grow from their experiences. So any mother out there, you're not alone. Like it's okay to cry. I just learned it's okay to cry. It just means that you love your child deeply, and then that love that will carry forever. Thank you so much.
Thank you guys both so much for sharing that. It's clear how how challenging this is for you, but how much strength you guys have brought through that. We have a number of questions from all that you've told us about so far. Diya, I think I'm going to start with you. The attendees are really interested in, when did you start getting back to all of your activities? When were you able to start swimming, and when did your pain settle down and go away?
I think it was definitely after my surgery, the first 6 months I wasn't allowed to do anything too severe. Um, I think it was mainly like just walking and um not even running or anything that could potentially make me fall down. I think my pain started going away after 3 months. It wasn't something that was like constant that I would think about every day. But if you did end up like touching my lower back or if I bumped into something, the pain was definitely still there. And even now, like there is that like weird sensation if you touch it. My lower back feels like numb and kind of tingly. It's not necessarily pain. The pain is gone, but it is like a weird kind of feeling.
Awesome. And Jyoti, what would you tell a parent who is facing the same thing now that you're kind of on the other side of it? What advice could you give someone that's at night crying the same way that you did?
I will say just take the advice of the expert, because we just did that. We just went with our doctor's advice and be strong. Like, I am not a strong mother, but Diya's dad is very strong. He used to like console me every time. It's okay. There is a solution to it, and we have very good doctors, and they'll take care of it. So just be strong and just trust on the system.
Oh, I think you guys are both extremely strong, and so strong, especially for coming on and sharing your personal stories with us. That shows more strength than anything. Thank you guys so much.
Thank you so much.
Awesome. Next, I'm happy to introduce you guys to Simrena. She's going to be talking to us about her vertebral body tethering treatment and how her life has been with that.
Hi everyone, my name is Simrena Atwal, and I'm here today to talk about a different possible route when faced with scoliosis, vertebral body tethering. So before we get started, let me just talk about some of the topics that we'll be covering. First, I'll have an introduction on who I am. Then we'll talk about what VBT actually is and how did my scoliosis journey start and how did I get to VBT. Then what my surgery and recovery experience was like and what my life is like now. Okay, so before we get into my scoliosis journey, I'd like to introduce myself properly. So as of right now, I am 14 years old and I'm in grade 9 going to DSS in Vancouver, BC. I have a family of 4, both my parents and my 7-year-old brother. I went through scoliosis VBT surgery in January of 2022, so 3 years ago. Okay, so one of the reasons my scoliosis story is so unique is because of how rare VBT surgery actually is. I'm sure many patients are faced with the tough decision of choosing whether to actually get surgery, and if so, which one. So let's talk about this next. What actually is vertebral body tethering? Essentially, the goal out of this surgery is for your curve to go straight as you are growing. And what the actual surgery is basically inserting a couple of rods into your back and a string to aid this growth. Now, the reason this is such a rare surgery is because you need to be in a specific growth period because you need to have enough room to grow. Usually this age bracket is about 10 to 14 years old. So another big question is, how is this surgery different from the other option, fusion surgery? Well, first, as I think Jen was saying, they cut through your side instead of your back. And here's a picture of the scars that I had through my side. And again, like I said, not everyone will be eligible for this depending where they're at in their growth. And another main advantage of the surgery is that most patients are more mobile than the fusion surgery because since there isn't as many rods, it's not as stiff and it's just easier to move around. And then again, the recovery process is way faster than fusion surgery. As a VBT patient, if you are eligible for the surgery, then I would definitely recommend it. So let's get into my scoliosis journey now. How did this all start? Well, to be honest, it did kind of come out of nowhere. At 10, my mom, being a typical mom, kept on nagging me about slouching every day. And when I'd listen for a moment, then fall back into my habits, she came to the conclusion that something was wrong, which thank God she did. Around October of 2021, we went to my family doctor, who then referred us to our local physio. There, we did a couple of exercises to maybe help my posture, but they weren't seeing any results. So they referred me to the amazing Scoli Clinic in Vancouver, BC, to get tested for scoliosis. And sure enough, there it was right there on the x-ray screen, my 54-degree curve. There we tried exercises for about a month, but it just wasn't really working. So that takes us to the next question. How did I get to VBT surgery? Well, after all of our efforts didn't work, I got referred to the amazing scoliosis specialist at BC Children's Hospital, Dr. Mianji. After we went to Dr. Mianji, he informed us that the curve isn't going down, which means that it still has the possibility of growing more, which could, in my case, have been a danger to my lungs and my heart. He told us right here it's pretty severe, so if it gets any worse, it would be a big danger. We were informed of the two surgeries, and since I was the perfect candidate of VBT surgery, me and my family chose this one. And this obviously was shocking news for me. However, I feel I had a very short time to process this. It was all in about 2 weeks from when I found out to the actual surgery. And I feel like this really helped me as I didn't really have much time to overthink. And I was 11 years old going through the surgery, so I had no idea what I was about to face, right? So now time for the actual surgery. What was it like? So the day finally came. It was January 26, 2022. And as I said, I was 11 years old. As you can imagine, I really had no idea what type of things to prepare myself for. Nobody in grade 6 had a surgery like mine, right? But I still remember so well. I was all set in my two little surgery braids, ready for whatever was to come. And the surgery itself lasted about 7 hours. When I woke up, I was super loopy and out of it, as anyone would be after anesthesia. And I had this huge pain, sort of aching yet pounding all over my back. I couldn't like pinpoint it anywhere. And here are some pictures of me on the first day. Obviously, the pain took a while to go away, and the nurses at the hospital were awesome at taking care of me. Now, finally, one could argue the most important part is how my recovery process was. I'm gonna be straight up, sometimes it was really, really hard. It took me 2 full days before I even started practicing to walk and a month before I could actually sleep soundly. I was fortunate enough to get out of the hospital on day 4, and here are some pictures of me that day. However, there would be some periods where I would be very depressed and very down, which is mostly because of the medication. But then I'd be really sad. Then a couple minutes later, I'd be really happy, just like the constant mood swings. I did feel like I was missing out on a lot, even though it wasn't that much. But my grade 6 dance, all my sports, my friends, and everything. And everyone just kept on saying that it would get better. But at that time, I just didn't really see how it could. Here's a picture of me after 1 week. In terms of mobility, I gained my walking back really fast. I could walk fully in about a week, and I could go back to school after 3 weeks. I could start doing little mobility exercises after 3 months, and my full recovery, I was completely back to normal after 6 months, which is really amazing. Well, now looking back at all the pain I suffered through the surgery, I wouldn't change it for a thing because, it's part of who I am. I'm living my best life. I'm completely mobile and I do enjoy many sports, including volleyball, softball, skiing, swimming. And sometimes there are even days that I forget I actually had the surgery. I'm so grateful to be here and I love sharing my story with people. And I'm so happy that I can say that I went through this proudly. Yeah, that's it.
Simrena, awesome job. That is such a cool story, and thank you so much for, sharing your journey. I am continuing to be humbled by how strong and how tough, all of you guys are. This is you're a continuing representation of that. So really great job. Awesome to hear how it went, your journey, because I know it wasn't easy. What would be your number one piece of it? So, what's your number one piece of advice to young people out there kind of facing the same thing that you were? If you were in their shoes now, what would you want to hear? One piece of advice would you give to folks out there in your shoes?
When I was going through this whole thing, I didn't really have anyone to go through, right? Like I wasn't aware of all these organizations, everything. We were really new to the scoliosis community, so we didn't really know who to talk to, what type of things. And I would encourage you to go to more webinars like this, maybe look at YouTube videos, everything, just see what the process and stuff was like. You know, if I were to do it again, I wish that I could have contacted more people, and I could. There's people out there who are willing to help, just like all of us here. And I just wish I had more of that, and I would really encourage people to do that.
I love it. And I think the world needs more of young ladies like you to help us shepherd along the next generation. Thank you so much, Simrena. You're
Thank
awesome.
you. Thank you.
Fantastic. Just want to remind everybody, if you can, along the way, participants, please send your questions into the Q&A section. If we can't answer them directly, we'll answer them through the chat. The presenters will do that for you. Now it's my pleasure to introduce the awesome Miss Jenny Liu, who's going to talk about her stories of hope, strength, and positivity as a scoliosis patient. Jenny.
So unlike these other wonderful young ladies, I was diagnosed with scoliosis at age 50. I had no idea that I had scoliosis. I had 3 decades of dancing. And I grew up as a concert pianist, and I also had a life of dancing and pageantry. And I also never had any pain in my scoliosis journey. I also grew up having a very disciplined childhood and always believed in working hard. So when I found out I had scoliosis at age 50, it was because I was running around the block and something happened to my hip. And what happened was I felt a little pain in my hip. And I went to the doctor and he said at age 50, did you know that you have a scoliosis curve? And I said, no, I don't. I've danced for 3 decades and never had any pain. So I don't understand what this scoliosis is. And he said to me, look, if you're not having any pain and you don't have, you maintain a normal weight and you eat right, don't do drugs and don't drink, you should be fine. And that was at age 50. Being that there was something wrong with my hip, I did have a hip replacement. So what ended up happening was after the hip replacement, I went back to my normal activities. I danced, I did yoga, I hiked, I did all kinds of things. And for 15 years, I never had any pain. So I danced for 3, so this shows my career as an adult. I also did pageantry work. I competed in beauty pageants because I love the stage. The scoliosis never stopped me. It wasn't until I was age 65 that my curve progressed to an actual hump in my back. And you can see here that I finally got myself to a scoliosis specialist who diagnosed me with a 47-degree Cobb angle, and it was very, very prominent. I still had no pain. The doctor said, you don't need surgery if you don't have pain. Let's just do physical therapy. So I did that. I continued to dance. I continued to hike, continued to do my piano work. However, in 2022, I did do a pageant, beauty pageant, where I almost fell over on stage because I was so weak. My curve had progressed to a point where I could no longer use my core muscles to really stand up straight. So at that point, I decided I was going to seek surgery. And I did it right away. The doctor said, you know what? You don't need surgery. You don't have any pain. But I said, you know what? I don't want to be in a wheelchair at age 80. And I sought 3 different opinions. And the third doctor, who was Dr. Bess at Denver International Spine Center, said, you know what? I can tell by your strength of your mind and your character that you will get through this. So I took those words and I built a foundation of strength within myself. I knew I had a career of dancing and modeling and did lots of things that I loved, and I wanted to continue to do all that. So I used every ounce of strength within myself to get through this surgery. I researched YouTube videos, I studied pain management, I did everything I could to make sure I was prepared for this surgery. I used my dance background to help me be aware of my body, and this is my surgery. I was fused from T9 all the way down to my pelvis. This is me after 1 day after my surgery on the right, and then a month after I met with my doctor. I would say the main thing that I learned to do was use the mental discipline and knowledge of my body that I had prior to my surgery, when I had no pain, to get me through the surgery. And interestingly enough, after surgery, I still had no pain. Consider myself one of the lucky ones. Using the mental strength that I had gained from my career as a dancer and a concert pianist helped me get through it. And it's not that I was not without challenges. As you can see on the left here, I was still a little tipped to the left, but through physical therapy and a lot of practice, I was able to stand up straight. And you can see my posture has improved over the 6 months. I'm a believer in pet therapy. I had a bunch of pets that kept me company throughout my recovery. I developed a support network. I stayed motivated, knowing that I wanted to continue to do the things that I love to do after I healed. I went to the ballet. I hiked the Grand Canyon. I also did something that was very helpful to me, was I created a journal for myself, called it Grace in Every Step. And every day I would write in my journal, according to a prompt, what made you feel better? What did you do today? And that somehow connected me with myself. And it allowed me to really share my experiences with other people in the scoliosis community. And that's how I came about Setting Scoliosis Straight Foundation. Today, I have no pain. I'm still dancing. I walk my dogs. I walk 3 or 4 miles a day. And you can see that my posture is pretty straight after all of that I went through. And my goal is to encourage everybody in the scoliosis community to find it within themselves, something about them that keeps them going, that gets them out of bed in the morning. I feel that this passion for doing what we love encourages us to move on, because there are obstacles. There's surgical pain, there's physical therapy, everybody has issues, but to tap into one's inner strength will propel the snowball to get going. And I believe that little by little, you begin to see progress. So that's my story.
Jenny, what a wonderful message. Thank you so much. I want everybody who's spoken here today to come with me to clinic tomorrow and talk to all of my patients and give them all these wonderful messages. Really, really great to hear. I was wondering, Jenny, what advice would you have to your younger self, or to somebody that might be having this curve, knows about this scoliosis, and maybe in their younger teens or their earlier 20s, or even younger than that? Would you have done something different knowing what you have known now and when you had surgery?
Well, I think at the time, I didn't believe it existed because I had no pain. My dance instructor even told me, you don't have scoliosis because you don't have pain. So I believe that. But when I saw within myself the hump getting bigger, I took it upon myself to seek out research, ask the experts, consult with doctors, go to places like the Setting Scoliosis Straight Foundation, educate ourselves, and make the decisions for ourselves. Nobody can tell the individual patient what to do. It has to come from the heart. And the decision to go with bracing, physical therapy, or surgery has to come from that person. And I encourage everybody who is encountering this to really go with what gives them peace of mind. Because having the surgery is not an easy thing to go through. And I know that there's a lot of fear involved. But I encourage people to go find the information, study, listen to YouTube videos, read books, talk to people, talk to doctors, and then do what gives you peace.
Really, really amazing message. Thank you so much. And gosh, thanks so much to everyone who has spoken so far. I've learned so much. And it's amazing that we've all stayed perfectly on time, which you guys are all hired to be professional speakers for us forever. And I'm really excited to introduce you next to Dr. Kyle Deane, who's going to talk to us about mental health and self-image, which is really perhaps the most critical, but maybe the most overlooked part of all of this. And I'm really, really excited to hear what he will teach me here. Thank you, and welcome, Dr. Deane.
Hi, everyone. Can you see my screen okay? All right, great. So yeah, I'm Dr. Kyle Deane. I'm a pediatric psychologist. I work at Shriners Children's in Chicago. And my research, I also do research as well with individuals who have chronic health conditions. And we develop things like tools that look at how families and youth are navigating having a chronic health condition. I mainly work with spinal cord injury and spina bifida, but we're really excited because our next steps are to adapt some of these tools for scoliosis as well. And at Shriners, I also work with our team. In your local clinics might have a similar kind of thing where there's a psychologist or a social worker that can come in and help with adjusting to a new diagnosis, processing treatment issues, things like that, working with families and kids on these issues. I'll do pre-surgical evaluations, and if kids do come in for surgeries, we'll work with them and support their recovery as well, and post-op as well. So I'm so thrilled to be here talking with you guys today. It's been truly inspiring for me to hear all these stories, and I'll be kind of supplementing it with a bit more on the emotional side of scoliosis and how to improve body image and confidence along the way. So we know that scoliosis is more than just a physical diagnosis. It's more than just a curve in a spine, because it really can affect how youth see themselves, how they think, and how they feel. And oftentimes this scoliosis comes in adolescence, when youth are kind of already navigating some tricky scenarios and social changes, body changes. So you throw scoliosis into the mix and it can present some challenges. But we also know that mental health support and techniques can help youth cope and build confidence and stay engaged in their treatment. And I always think that mental health is not about avoiding stress. Life is not about avoiding stress. There's going to be stressful things that happen. It's about how to deal with that stress and cope with it and grow with it. And I see that in my patients and families all the time, that growth. And parents and providers really play a key role here of viewing the patient, viewing the family, not just the medical pieces, but also as social creatures, as emotional people, right? And fostering those things and validating those emotions can be really helpful. So some of the common emotional experiences that youth experience, people on this call, you may have experienced some or all of these. They're very common. Anxiety about what treatment might look like, what I might look like. Frustration, right? My brace really stinks, or why did this happen to me? Body image concerns, especially in adolescence, that can become more and more salient and important to the youth. And then some adherence stress, right? It can be challenging emotionally and physically wearing a brace. And kind of working through those issues can be difficult, especially when you're feeling stigmatized and maybe you haven't shared it with your friends and you feel like maybe they don't quite understand what's going on at that point. Sticking with body image for a minute. So one of the things we know that is linked with sort of, while it's normal to have some body image concerns when you're feeling this way, we know that is predictive of some of these body image concerns is spending a lot of time in front of screens and social media. So these platforms like TikTok, Instagram, you're comparing yourself maybe to a perfect ideal person and a perfectly curated life that's you're never going to stack up to, right? So we encourage a minimal amount of social media, but like even 30 minutes per day, especially for girls, can be harmful to their sleep, to their anxiety and self-esteem. So trying to cut down on that and control that can be really helpful. Even screen time in general, 1 to 2 hours per day is what is recommended, no more than that. Once you get beyond that, we're starting to see some of the negative effects. Things that I always tell patients is not having phones or TV in bed to protect sleep. We know how important sleep is for mental health and learning and all sorts of things. So cutting out kind of having your phone or a TV in bed can be really helpful. Your brain it's a connection making machine. All the time we're making connections. And if you're laying in bed and your phone is super designed to be interesting and engaging and really excite you, and if you're laying in bed and feeling that excitement, your brain's drawing the link. Well, this is the place where I'm really excited and have fun, or get bummed out seeing people's social media posts or whatever. So then when your head hits the pillow, your brain starts really going into overdrive when it's supposed to just fall right to sleep. So cutting that out can be helpful. Setting limits on social media can be helpful as well, and finding other activities. We just want to avoid using screens, especially when they're taking away from some of these great activities that these other speakers have been talking about, dancing and other activities. So what can parents do? Be mindful of your own habits with screens, and also like keeping a mind out for with body image issues. If you're seeing some red flags, things like changes in diet, things like changes in sleep. If you're seeing your kid becoming more socially withdrawn, if your kid's changing, they're not quite your kid, trusting your instincts and reaching out for help at that point, or just simply checking in with the kid at that point. That might be a red flag. Some your mind's telling you something. So what are some of the strategies that we can do to help manage these feelings? Well, first off, just acknowledging that they're normal. It's totally okay to feel overwhelmed. You don't need to feel like you're fine and you're strong all the time. It's normal to feel overwhelmed. One of the techniques I do to teach families a lot, if you're feeling overwhelmed, if you're experiencing a lot of anxiety or in your brace, is the 5, 4, 3, 2, 1 grounding technique. It's just a way of engaging your senses and connecting you with the current world and your current moment. You think of 5 things that you can see, or you identify 5 things that you can see in your head, 4 things that you can feel, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste or imagine tasting. It's not a silver bullet, but it kind of brings your body back, brings your mind back when your mind's trying to race. There's a lot of great resources and sheets like that and coping strategies on childmind.org. That is really helpful. They have worksheets for parents and to work with for kids as well, and youth. If you're adolescents, if you're on the call, you can check that out as well. It's a lot of good resources there. Other things are peer connection, so connecting with people you trust and parents, talking it out with people and finding groups like the current group we're working with now. One of the things I study is cognitive appraisals. So that's just kind of a fancy way of saying like how you interpret a situation really influences how you feel and how you act about it. And when I work with patients and families, I'm always checking out how they're feeling about the situation, right? Not just the severity of the curve or whatever, but how they're interpreting it. Are they feeling hopeless or hopeful or scared? Because that's going to inform how you act, right? So for an example of that is thinking of your brace as, you're super frustrated and you hate wearing your brace. That's going to be hard to cope with it. My brace is terrible. Whereas if you flip that thought and think about it as your brace as a tool that can help you get to where you need to be or avoid surgery or whatever, it can be a little easier to cope with. Finding things that help you relax, that everyone said on the call is really, or on this webinar, music, gaming, journaling, drawing can be great outlets for that. Above all, remember your resilience. You're not fragile. In fact, younger kids are anti-fragile. If things happen to them, stressors, they become stronger. So trying to view this experience, even though it can be challenging at times, as something that can grow you as a person, to become more empathetic, to become stronger, to become more flexible. So Kelly kind of mentioned that as well. That struck me, that she felt like this was an experience that made her more of an empathetic person. For parents, what can you do? Some of the basic things you can do is encouraging some of these discussion about these negative emotions, even the harder ones. It can be challenging as a parent to hear your kid sharing negative emotions, but saving some space for them to talk with you and being open, directly checking in can be really important and therapeutic and helpful to the family. Modeling your own reactions as well. It's totally normal, again, to feel anxiety, to feel fear, stress, but trying to model that calm and that reframing of certain thoughts during stressful moments. That they look to you for how to act. Reinforcing some of that positive appraisal and flexible problem solving. As kids are getting older and into adolescence, we really want to support them, but also let them make their own, solve their own problems, right? So not getting too involved and giving them a little space to come up with some decisions on their own as well. Some other ways to build confidence and have a healthy self-image. So I always think about it in 2 ways. Think about activities that can boost your competence or your mastery, something that you can get better and better and better at. And then things that are just your joy, right? The things that bring you joy. So even as a family, write down, if there's certain physical limitations or medical restrictions or things like that, write down, what are some things I can get better at? What are things I can practice and grow? Or what are things that are just fun? And let's pick one to do. Just keeping active is really important. Celebrating strengths beyond your appearance, like humor and kindness, that's really important. Listening to stories like these, connecting with others can be super helpful, and sharing with others can be a really powerful thing to improve that self-efficacy and that confidence, that sharing your story with others. you can decide when you want to share with others, how you want to. I do think that it's so helpful, especially if this is new to you, to work with your family on some scripts at home, to think about ways that you can role play some of these things. How am I going to tell my teacher? How am I going to tell my friends? It makes it a little easier as you get more and more practice to do that. So concluding thoughts, parents especially listen. Most youth with scoliosis lead healthy, full, confident, awesome lives. Emotional challenges are real, but they're manageable, and oftentimes they're temporary. There's really no right way to feel, but know that you're not alone in how you feel. Mental strength is just as important as physical health, which so many of you have said today. You're navigating something tough, but that's making you a stronger, more empathic, and more flexible person. And if things are overwhelming, talk to someone about that. Reach out to mom or dad, reach out to your doctor. Mom and dad, if you're at an appointment, see if you can talk with someone about that there or ask for more resources. That's always something to consider as well. So thank you so much for the opportunity. Again, I'm happy to answer any questions that you have offline or now. And here's my email as well. If you feel like you want to email me, happy to connect. Thank you so much for your time.
Dr. Deane, that was fantastic. Thank you very much. I think it's so important to have this as part of the discussion, because this is certainly a big weight on the shoulders of the young ladies and young guys that are out there managing this, but also the superstars like Jenny and Jyoti are out there as well, who have been dealing with this for a long time. So thank you very much, and bringing this all out into the open, I think, is very important. What's your best advice? Because I know just getting, I have 3 teenagers, which is awesome. They tell me everything, which they don't. So what's your best advice to kids about how to start talking about it? Like, how do you help them to kind of start the conversation? Because sometimes that can be the hardest, to sort of talk about what's bugging them. And then same thing for parents. How do you get them comfortable, talking to you and talking to their kids?
Yeah, so I'll start with for parents. I think a great way to do that is to have one-on-one time with your kids. If you have multiple children, your house is busy, life gets in the way, but to have a little time for a one-on-one, and then to intentionally check in, to not be afraid of that maybe negative response. It can be really hard to hear, but to just engage with them and ask specifically, hey, how was school today? Was there anything rough that happened? Or how are you feeling about your scoliosis? Like, how are you navigating that? To ask those direct questions. It can be easy day in and day out to kind of forget to do that, but checking in can be really helpful. And then for kids, as your parents have a nice open communication with you, that can be helpful, but just practicing, right? As you start to tell your story over and over, it becomes a little more natural and you're desensitized to it, right? So if you're a young person, you've been diagnosed with scoliosis, or you're having to wear a brace, it can, that initial, communicating that with someone initially can be very hard. You'll find as you start to communicate that to mom and dad, your feelings, then to your friends, it becomes easier with time. It's kind of a practice makes perfect policy. So that's what I would encourage you to do.
Love it. Thank you, Dr. Deane. We have one question from the chat, and our last question would be from the chat. Just one of the participants want to know, have you ever had patients that say, I'm fine, everything's good, just trying to push it down, but they don't know that there's, behind the scenes, they're having some challenges. So have you seen that a lot? And what are some strategies you may have for those that are going through that, just trying to, again, repress those sort of emotions?
Yeah, it kind of goes to similar with, having an open dialogue can be really challenging, but making an intentional effort to do that. As you're, if sometimes kids are okay, right? Sometimes they are like, can get through things. And if they're the type of personality that really are just, they seem like they're doing okay, they're eating right, they're sleeping okay, their grades are good. Those are good positive signs. You give the opportunity for them to share. They may come to you and at a moment and want to share with you, but just continuing to try can be really helpful. And then always, as I mentioned, sometimes if things are really looking harder and they're really not willing to talk to you, sometimes it can be helpful to talk to someone outside of you, right? So if you think about a counselor at school or a psychologist or someone outside of you, it can be a little easier to share. You don't necessarily want to share everything with mom and dad. It's important to have that good dialogue, but sometimes it can be a little easier to share with someone who's outside of the family. So finding someone like that can be really powerful for a lot of people.
That's awesome. Dr. Deane, thank you very much. I wish we could talk to everybody on this panel for another hour. This has been an incredible hour with us. Thank you all for sharing your experiences, your knowledge, your everything you've been through has been really helpful for me. And I've been doing this for a long time, so I learn something every time I get to be on one of these webinars. So it's been truly an honor. We'll turn it over to Jen, who's going to take us home.
Echo that. Thank you guys so much. And really thank you to the Setting Scoliosis Straight for hosting this for us, for giving us this opportunity to have this conversation. Setting Scoliosis Straight also funds a lot of research that helps get us to some of the answers that we have for those of you that have scoliosis. And so if anybody is interested in giving sending any sign of appreciation or support, here's some information here if you'd like to do so. There are a number of more resources available to you from Setting Scoliosis Straight, including this handbook, which is awesome. You can get your camera out and snap a photo of this, but it is also on the website, Setting Scoliosis Straight. It can take you from start to finish diagnosis to through surgery and has a lot of amazing information in it if you're facing this right now. So I definitely encourage you to go take a look at that. We also have a YouTube channel with a bunch of informative videos that can help talk to you about surgery and braces and more patient stories, which I think are the greatest things that we're able to learn from here today. And because I think that it's so great to have these contacts and ability to talk to either patients or surgeons or parents. We have some more webinars coming up. So please, if you are interested in this, if you know anyone, pass it along. We have one coming up in August on Scheuermann's kyphosis and another in October on vertebral body tethering. So don't miss this. If you like this and you're looking at tethering or Scheuermann's kyphosis, please join us again. And for this and so much more, you can find it all on our website. Please visit and take all that we have to offer. Thank you guys all so much for joining us. Really, and the fact that we were able to do this during Scoliosis Awareness Day and month, Scoliosis Awareness Month right now, it's awesome. One organization that is near and dear to my heart as well is this Higgy Bears organization, which creates teddy bears with braces or with rods in their back, and they're really awesome to pass along. The color for Scoliosis Awareness is green, and I'm actually from 20 minutes away from Niagara Falls, so I wish I was there at home to see this. But this is going to be really awesome, and you can sign on online to see this here tonight with the whole falls lighting up. Thank you guys again so much. Please feel free to email us, call us, and there will be a survey sent out to you. If you could fill that out, that really helps us shape these webinars for the future to try to make them as useful to you as we possibly can. Okay, thank you again to all of our panelists so much. Thank you to the attendees for joining. Have a great night, everybody.
Great job, everybody. Thanks again.